So I thought we'd run through what we should be doing with newly diagnosed cats. I'm sure it's what you're doing already, and what other stuff has come up, particularly in recent times, and have a look at these sort of new or newish treatment options. So the YD, which seems to have gone a bit out of fashion, I think, and the transdermal methimazole. So there are some guidelines available on how to treat hyperthyroid cats. They're both accessible free, I think. So the JFMS paper is 2016 and the JSAT one's 2014, so you can take them off the internet yourself. So how should we be managing newly diagnosed cats? Okay, medical stabilisation is a no-brainer, right? Unless you've got a very angry cat for some reason, you would choose to medically stabilise it first. Why do we want to medically stabilise it first?
Risk reduction.
Yeah, what risks?
Well, like a GA risk if you're thinking about going for surgery.
Yeah.
Then they don't want you on treatment just before you're radioactive.
Yeah. So if you were going to go for surgery, then and reducing anaesthetic risk. Why else do we do medical treatment first? See how the cat gets on? Yeah, absolutely. What's the main reason? So I was hypothyroid at the start of this year, and the main reason that you start medical treatment is because you feel absolutely awful. So don't underestimate these cats feel sick. Okay, the sooner they get started on thyroid meds, the sooner they will feel better. Okay, so when they sit in the corner panting at you, feeling like they're going to die, they feel like they're going to die. So the tablets will make them feel better, okay, and our aim is to make them feel better, right? So the main reason we get them started on medical treatment is the quickest thing you can organise, okay? You put that cat on a waiting list for radioactive iodine, it's probably going to be waiting for about a month, right? And they don't like to treat them when they're hyperthyroid, okay? The medical treatment will work quickly and it will make the cat feel better quickly, okay? So that's the main reason why we need to do that. Two medication choices, so carbimazole and methimazole, they're essentially the same. So carbimazole is a prodrug of methimazole. If for some reason you needed to flip the dose, so for example, the carbimazole you can't split in the formulation we have for cats, and the methimazole you can, so if for some reason you wanted to flip it over onto methimazole, 5 milligrams of carbimazole is 3 milligrams of methimazole. And the traditional recommendations are to aim for the lower half of the reference range. It's not based on a lot, that recommendation, but obviously we all know it seems to do the trick. What's the starting dose? Yeah, there's a bunch of stuff you see out there, isn't there? So some of the places differ the starting dose based on the level of T4, and some of them don't. Probably it doesn't need to be differentiated on the level of T4. So the recommendations would be 10 milligrams of carb or 2.5 milligrams twice a day of methimazole. The rationale for giving the methimazole twice a day is that they get euthyroid quicker, okay? And as someone who was hyperthyroid, the sooner you are euthyroid, the sooner you will feel better, okay? So about 85% of cats will be euthyroid in a couple of weeks if you're on BID methimazole, and only 70% of SID. So it just makes them better quicker, okay? Once they are euthyroid, there's no benefit of them being on BID treatment for methimazole. So, cats don't like being tableted, owners don't like tableting cats. So as soon as they're euthyroid, just condense the dose to SID, okay? Adverse effects of carbimazole and methimazole. What are they? There's quite a few, so you're probably going to get it right even if you're guessing.
Pruritus.
Yeah, head and neck pruritus can be quite dramatic, can't it? It can be a bit of a catastrophic problem. Yeah. Vomiting, yeah. So the most common problem that we see is vomiting plus minus diarrhea. We don't really know why it is. It's probably due to direct effect of the tablets on the stomach. We're not really sure. What are the other ones that we sort of worry about can be more problematic? Tell me again, sorry. Hematological, yeah, exactly. So they can get bone marrow dyscrasias and they can get hepatopathies as well as a result of the tablets. So most common is gastrointestinal, okay? What's the important fact to remember that if your cat has a problem on carbimazole, would you switch it to methimazole? No, they're the same drug. So as soon as you give the carbimazole to the cat, it's metabolized to methimazole. So if it has a problem with one, it will have a problem with the other. Okay, so if your cat has blood dyscrasias, whatever you like, on methimazole or carbimazole, don't switch it to the other one. You'll very likely replicate them. In cats and dogs, we don't have other medical options. Okay, in people they do, but in cats and dogs we don't. The only sort of slipstream would be that the transdermal methimazole is less likely to cause gastrointestinal problems. So if the GI signs are what you're seeing, you may be worth switching to the transdermal, and you may get away with it on transdermal. Okay, probably not great for the long term. I'll show you later. But if the GI is the problem, that's the kind of exception to the rule.